So basically, what are the various sectors that are involved in the healthcare industries are like preventive care, primary care or specialized care, and emergency care. Like preventive care means which aims to prevent the illnesses before it starts itself. So that is one sector that we can hear about in the healthcare industries. And primary care. So basically, primary care means it often looks at the patients as a first point of contact, which primarily focuses uh, on resolving the healthcare issues, routine checkups, minor illness, and all such. Okay, and then comes the specialized care. So specialized cares are like specialists such as cardiologist, neurologist, or oncologist, which will target or provide treatment for a specific disease or a specific area of your human body. So those are called as specialized cares. Okay, and then comes emergency care. So emergency care means like emergency services which needs urgent and potential life threatening conditions. So anyone who looks after that comes under the emergency sector or emergency care of the healthcare industry. And then some long term care, like some of the patients uh, needs to get the services or focus on regaining the health after illness or injury. So they need to go through some physical therapy, occupational therapy, like some long term support is needed. So anyone who considers or looks after this area can be considered as a rehabilitation or long term. So those are some of the sectors that we often look into the healthcare industry. And then what are the some of the healthcare systems or delivery models that are available outside, which have been basically these are the models or delivery models that you see or you often hear. So one is public health systems. So public health systems are nothing but governments manage the health initiatives, or government is going to manage the health industry, like by providing government hospitals for treatment for the people and all. So anything that is being managed by government will come under public healthcare system model. These are all the delivery models that you listen or you often hear in the healthcare industry. Okay, so one is public healthcare system, the other one is private healthcare system. So basically, private healthcare system are nothing but a healthcare industry which is owned by private entities, or funded by private insurance companies. Okay, or private owned organizations falls under these private healthcare systems. Okay, and let me know, like anywhere you are having any doubt or anything is needed, please feel free to ask in the middle. I'll be continuing with the topics, but please feel free to ask. Okay, and then comes the other system is hybrid system. So hybrid system is like nothing but some of the countries will follow this delivery model, where they'll include public and private healthcare bodies to balance out the accesses and efficiency of these deliveries. Okay, delivery system. So that is like hybrid system, which involves both government and private entities. Some of the countries like UK and all, they'll fall under these hybrid systems. They follow these hybrid systems. Okay, and then integrated and coordinated care models, like these are like care these are like entities or delivery models which focus on delivering healthcare across the settings, like accountable they're basically used for coordinating the patient care among providers and reducing the redundancies. So this is a different delivery model that is available in most of the time. Okay, these are the four different delivery models. And these these are the roles that we generally hear or we see in the healthcare uh, industry. So whenever we talk about the healthcare industry, so these are the common participants, we say, or roles or personas. So these are some terminologies or some people who are being referred in the healthcare industry. So the first one and foremost one is the provider. So whenever you hear the term provider, it is nothing but it is referred to as a physician, that nothing but doctor or nurses. So providers can be either a doctor or a nurse. Nothing but providers are means they're providing us the service. So whoever is going to provide the service, they all fall under this category. So okay, providers are like physicians or nurses, like who actually offers the services, and they are the ones who are responsible for reviewing the patient records, going through the documents, patient documents, which will give us the all the information about the patient, like about his demographic information, about his health information, and all, whoever it is going to be reviewed. So and also these are the ones who are responsible for taking the clinical decisions, like what needs to be done at what point in time, whether so those are called as providers who are going to provide us the service. And then comes front desk staff. So front desk staff are nothing but like receptionists who handles the patient appointments, scheduling the appointments, and who who will be responsible for taking the patient information, like initial data entry about the complete patient records. For managing all the patient information, they'll be maintaining the records, right? So front desk staff are the receptionists who are responsible for that. And some other roles that we normally look into or hear is about medical coders or billers. So these are the staff who is responsible for translating the translating the diagnosis and treatments that we get from the hospital, right? So they are the responsible entities for converting those diagnosis or treatments into billing codes. Okay, billing codes means like they'll consider, like if it is if a patient has undergone a surgery, so they in a medical field, for every surgery or for everything, for every treatment that you go through, there will be a code associated as per the government policies for the country that you are going through the you are receiving the treatment, right? Every country will have their own set of government policies or health policies, and then each of the treatment or service that you get in the provide from the providers, right? They will maintain a code. So each code will have a certain billing billing associated with it. Like if you go through a eye surgery, then they will say for eye surgery this is a billing code, and then it will include a package, like what are the general billing details. So those so medical coders or billers are the parties responsible for converting our services or treatments that we receive from the providers, and they will convert that into appropriate billing codes, and then they will be generating us the bills. And also they are the responsible parties for the insurance and payment processing and bill generations. Okay, so those are the other roles that we generally hear about. And then comes the clinical support staff. So these are like members who record vital signs, uh, and who are responsible for taking the preparations of the patients, like whenever a patient is going to the surgery, so there will be some prep work that needs to be done, right? So those prep work. And also these are the ones who are responsible for lab technicians or medical assistants, and coordinating with the results of the lab, surgery results, and all. So these are the clinical support staff. Okay, and then comes the IT administrators. Like they are the responsible for maintaining the whole IT infrastructure of the uh, mm, hospitals or providers, who is going to digitalize these things, right? So IT administrators are the one who is going to take care of that IT thing. Okay, and health information managers, and the last one is the patients. So patients are nothing but who are the parties who is going to take the service from the providers. So like who is going to access their health information, lab results, and communicates with the doctors. Okay, so and patients will be generally meeting with the doctors personally, or sometimes in the digitalized environment through telecommunications, and or through some patient portals like web portals, or through some software apps. We will be able to access the healthcare information that we have gone through in the hospital, right? So every hospital will provide their own web portal or some software app to access our records, to access our information, what are the lab results, and all those. So these are the some typical roles that we see or we hear in the general healthcare industry. So any questions till this point in time, like very high level? Okay, fine. So we heard about what a healthcare domain and all about, right? Now, uh, so this is a EHR system. So basically, whatever that we have seen the healthcare industry. So if we want to digitalize this healthcare industries or digitalize this domain, and we want to develop a software that will take care of all the things that we are involving, like communications and all. So we need a software, and that system is nothing but a electronic health record system. We consider that as a EHR system. So basically, an EHR system is a digital platform which centralizes or organizes a patient medical information, and which helps the healthcare providers to access that information, update that information uh, with the findings uh, or the treatment that they have identified and that they need to go through or they need to provide. So all this software, the software behind which helps the different roles that we have seen in the previous slide for communicating or going or discussing among them through digitalized manner is the EHR system, so electronic health record based system. Okay, so they will be helping us in tracking the medical history of the patient, and also they will help us in understanding the diagnosis that the patient has gone through previously, and other treatment plans or lab results or imaging reports, and they will also help us in understanding or getting the social history of the or family history of the patient, which helps the providers in understanding from where the what is a patient illness history, like what are the different illnesses he was having. So those all information, when it is digitalized, so people can easily get them, and that digitalization is done using the a system called EHR system. So whenever you heard the term about EHR system, it is nothing but a software that will involve or digitalizes all the parties that we have discussed. Okay, and so what is that? What are the benefits that we get if we are using these EHR systems? So like they'll help us in getting the improved quality of the care, and enhanced patient safety and efficiency as well, because they reduce the paperwork and they streamline all the tasks, and also they will provide us a workflow, like a sequence of steps or a step by step that we can participate. Okay, and interoperability. Like interoperability means nothing but uh, uh, a patient needs to be transferred from one hospital to another hospital for getting a better treatment, or for getting some enhanced treatment because of some facilities that are not available in this say in this hospital. So then what happens? You need to do we need to go through the whole workflow, like whatever the patient records, everything has to be reworked or re-entered in the another hospital system. That is a painful thing, right? So if we are using these EHR based systems, we can transfer the records, the complete patient records, the treatment records, the complete medication that a doctor has been provided till now. All that records we can digitalizely transfer from one healthcare based system to another healthcare based system. So that exchanging or transfer comes under interoperability. So that will be a easy thing. Otherwise, if we need to do go through the whole cycle of thing, means it's a, or if it is a, if it is not digitalized, if we need to do it manually, it is a very painful thing, right? So that is where this EHR based systems will give us some benefit. Okay, and also the other thing is like interoperability means like lab reports are there. Now you have sent results, like they have taken some tests, and you need to get those test results. Then previously we have to get them manually, like one of us need to go to that lab thing and get the reports and then show it. But with this interoperability in the EHR systems, we can directly connect to the lab and fetch the lab results once they are ready. So those are all things that will get benefited with this EHR based system. And then most of the EHR systems also will provide patient engagement, like using the application software apps or using telecommunications. They'll provide doctor-patient interactions, which helps in easy thing, getting the services easily. And also managing the, we can also manage the appointments and communication with the providers. Everything can be done using this patient engagement with the EHR system. So that is about the software that will be helping in digitalizing this, okay, healthcare industry EHR system. So coming to the next thing, if we consider a EHR system, okay, an electronic health record system. So these are the some of the key modules generally we look into or we hear in the electronic health records based system. Okay, one is patient registration module. So let me go one by one. What each generally these are all general terminologies, or general tendency that you'll see in a software that will be used in a healthcare domain. Okay, these are the modules that will help us in these are see, an EHR is a system is a very typical or a big system, a big software that involves various parties, different roles. So if then for easier accessing, and also they have modularized this EHR systems, and generally these are the modules that you hear about. So each module has a typical functionality or typical role in this software. So these are general terms. Not every EHR system might be following this, but on a very high level, this is how you might be looking into. Or if you're trying to come up with a hospital management system or a EHR based system, then these are the some of the modules that you'll try to come up or you'll try to hear in general. Okay, so first is patient registration module. So okay, I'll come back to this modules. Before getting into these modules, what I wanted to give is a general idea or a workflow how a patient and EHR system will be engaged. Okay, so then we can come into these modules so that you can easily understand them. So a typical workflow, whenever we will see in a EHR system or a hospital, when we enter a hospital, these are the typical workflows that we'll see generally. So the first thing is scheduling. So whenever a patient wants to get some treatment from a hospital, or he wants to get some understanding of the disease or illness that he's seeing, he wants to talk to a doctor and get some advice from him, right? So in such scenarios, these are the typical workflow that we'll be following or we'll be hearing out. So first step is a patient will be turning out to the medical facility, and then he will talk to the front desk staff. Front desk staff is nothing but a receptionist who is available for giving us the services from the doctor. So that patient will talk to the front desk staff, and he will explain about his problem, and then he will try to get the appointment of the concerned doctor. Okay, for that, what happens, the front desk receptionist will try to ask what is the problem of the patient, and what is the symptoms, what is that generally looking after, and accordingly she will try to make a appointment with the doctor who is available for that specialized area. Okay, by looking at the calendar of that doctor availability, and this front desk will make an appointment, and it will sync with the doctor's schedule so that we can get the services from the doctor. And then once their appointment has been done, so it is nothing but scheduling is done, then the doctor will get an appointment notification saying that this specific patient is waiting for this specific information or specific treatment. So then what happens, the doctor, if he is available at that point in time, he will accept that appointment, and he will go through all the details provided or specified by the patient, and he will go step by step, like he will diagnose the details step by step, and he will provide some actions or some prescriptions like that. So this all comes under medical assistant or provider assistant or provider visit. So the first step is a scheduling or check-in, and the second step is like a doctor going through with the patient, talking and diagnosing and providing the appropriate treatment. Okay, and then comes the last step is like a checkout. So once we got all the treatment related information from the doctor, the next step is we go back to the practitioner or a friend desk staff, and we will check out, like we'll pay the bill based on the treatment that we have taken and the services or medication that doctor has provided. And if you have some insurance, this is the place where the billing staff will help us in uh, giving generating the bill. So this is a real typical workflow that we see in any EHR based system. So this one, okay, this one is like a, what are the general things that we look into, like what are the different modules that I spoke about, right? I'll go to that in detail. Mm. And these are the roles that you generally see, like whatever we have talked about. And this is the typical workflow that we are talked about, like a patient visiting the clinic, and then the front desk staff who is going to uh, do the appointment and all. Okay, so this is a typical workflow. And now that we have seen this typical workflow, let's go back to these modules that you generally hear in a healthcare industry. So first is a patient registration module. This is, and the second is a scheduling module. These together, you must be understanding now. This is the modules where patient will interact with the front desk staff and will accordingly create the appointments and get the appointments sorted and all those. Okay. So that is the, these are the modules that will help us in getting that services. And then the clinical documentation module. So this is a module where the healthcare providers or doctors will go through the patient history and will talk to the patient, and then he will provide all the he will document, basically he will document everything, like what is the patient encounters, what patient has told about the issues that he was facing, and then accordingly uh, doctor will provide the prescriptions, and he will take the vital signs, like check the BP, sugar, and all those things, right? And then everything needs to be documented so that in the next visit he can again recheck them, or we'll know the things like where and how the patient is going through. So that is all will be part of this clinical documentation module. So it is nothing but it will provide a templates for getting the structured data entry and improving the accuracy and also the completeness of the whole clinical notes. Okay, and then the another module is like a medication management module. So this module is responsible for tracking all the prescriptions the doctor has provided, including the dosages, schedules, and at what point in time how much medicine needs to be taken. All that can be accessed from this module generally. Okay, medical management module or medication management module. Then comes laboratory or radiology information system. This is like all the lab system, all labs, lab reports, and everything can be managed from this module. And then some of the other modules like billing system or revenue cycle management system. So this module is responsible for all the billing, insurance, and everything. Okay, and then comes the patient portal module. So this is a module where patient will be interacting with the healthcare providers. And then comes the analytics and reporting module. So this is a module where it basically aggregates and analyzes all the data within the EHR system for populating the patient health management, performance metrics, and quality improvements or patient improvements that can be taken up, all those things. Okay, and then comes the interoperability module. So interoperability, we have discussed about what it is and why it is. So this is the place where we can communicate with other roles that are involved with like other EHR based systems or something like that. Okay, yeah. So these are the typical modules that you'll be seeing. This is how generally the software in an EHR based system will be available, the modules and all. And this comes like this slide will be typically talking about the general terminologies that you will be hearing, like because in a healthcare industry, if you go to a hospital, you'll be hearing a lot of terminologies, right? So these are the some common terminologies that will be available. So I've tried to give description about all the terminologies, like what a subscriber means, what a member means, provider means nothing but who, where we can go and get the treatment. Like formal definition is like any individual, institution or agency that provide health service to the healthcare consumers are called as providers. So providers means it's not just the doctors or nurse, it could be even a hospital is comes under a provider only. Okay. And then come claims, like claims are nothing but insurance claims that we hear. And then copay or co-insurance. So copay or co-insurance is something like a form of medical cost sharing in health insurance plan that requires an insured person to pay stated, like copay or co-insurance is a terminologies that we hear a lot in a healthcare industry whenever we are taking some insurance. So this is a amount that we need to bear, like insurance will be giving us some certain amount, and some percentage of amount we have to bear from our pockets, so that is called as copay. Okay. And then fully insured plan means everything will be provided by the insurance itself, or some financial company who is going to provide us the insurance. That is fully insured plan. Broker. Broker is nothing but an insurance broker, who is a person who is responsible for negotiating or getting the insurance between the insurance company and hospital and patient. So this is a broker. And CPT code. So basically, this is a like this is a procedural terminology code. Like I mentioned, for every treatment that we get, there will be a associated code, and that code is called as CPT code, Contemporary Procedural Terminology Code. Okay. For every treatment, for every service that we get from the provider, everything will be associated with the code, and that code is termed as generally CPT code. Okay, co-payment is nothing but what we discussed. Deductible. Deductible is nothing but like a fixed amount that gets deducted every year from the insurance taken person. Like whoever is going to take the obtain the insurance, right? For them, certain amount will be deducted. That is called as deductible. And then Medicare. So this is one more terminology that we hear. So Medicare is nothing but a government health insurance program. For the patients who are above the age of 65, and or it depends. This Medicare is a like on a general, it's a government health insurance program. Okay. Medicaid is like reimbursements, medical reimbursements that we get from the government, right? That falls under Medicaid. And HIPAA is nothing but a system. This is a system that will provide all the rules and regulations that every doctor, hospital, or any healthcare providers or health insurance companies needs to follow. So that is termed as HIPAA. Okay. So till now, whatever we have seen, right? These are all the terminologies or some things that we hear in the healthcare industry. These are like some of the terms that we hear in the in a general day-to-day things, like patient demographics. Patient demographics is nothing but it is a demographics means it includes all the details about the patient, like what is a complete details about the patient, like his full name, father's name, mother's name, and then address, from which part of the country or which place he's there, the full address, and then the social history or the family history. Like so, this gives like a complete profile about a patient. So getting the complete details about the patient is termed as a patient demographics. Diagnosis means like a list of treatments or services that he has gone through. Medications, like what is a medication that a provider has provided, that medical pharmacies things that he has to get. All that information comes under medications. Procedures like are like treatments or surgeries that a patient has gone through. Treatment history are like whatever the previous surgical or previous treatment that has gone through by the patient. That is a treatment history. And laboratory tests and diagnostic images. So diagnostic images means like our x-rays and all. This all falls under diagnostic images. So now next comes the, like, how do we design a database, or generally we have seen different participants, different modules, and different things, right, till now. So if I want to design a database or a software for these things, like what generally we'll see. So we have gone through different modules, right? Like patient management module, and also we have gone through them. So if we take an example or a simple example for like how do you define a database system for such a healthcare industry or EHR based systems. So this is a typical ER diagram, an entity relationship diagram that you can come up or you can design typically for a healthcare systems. So here this ER diagram is not considering the full healthcare system. It is only considering for couple of modules like patient management module and appointment management module, billing management module, inventory module, and doctor management module. If we take these typical modules, then this is how the ER diagram, I think you all must be knowing what an entity relationship diagram is. Like whatever the diagram that you see, that will be converted into a backend tables and columns in a database system. Correct. So this is how in general you can come up with each rectangle here represents a table in the database. Like generally, who are the participants that we have gone through? For each of the participants, like for a patient, we need to maintain a lot of information, right? Like previously I was referring to patient demographics. So that means we need to store a lot of information about the patient. So that information can be uh, composed or can be considered in as part of this table called patient table. We can create a patient table and store all the information about that patient, like what is the address, phone, gender, date of birth, last name, first name, and then what is the patient ID. Patient ID is nothing but medical record number. Generally, in a medical terminology, we consider that as a unique ID that is being given to patient, which is termed as medical record number, MRN. Okay, that will always be unique. So this is how a typical patient table can be considered. And then comes an appointment. Like what is the first step that we see? A patient needs to uh, generate or create an appointment with the doctor, right? So this appointment, for that we can create our own table called appointment table, and this entity will be responsible for managing the appointments for patient, linking them to specific doctors, and tracking the appointment status and all that information we can hold it in this table called appointment table. And this will be each patient can take any number of appointments with the same doctor or any typical doctors. So that why patient ID here is not a unique. So we can have multiple appointments getting created for same patient. Okay, so every time an appointment has been generated for a patient, an appointment ID will be uniquely generated, so that can be considered as a unique key. And then what is a doctor ID, and what is the appointment date, and what is the status of the current status of the appointment, whether it has been started or in progress, or it has been suspended for some time or kept in hold, or it has been completed, like that. We can track all the complete information. And generally, like patient ID and doctor IDs are nothing but a foreign keys here. Like you can see here, an appointment and patient table, they are linked using this foreign key called patient ID. So this linkage is referred as a foreign key here. Okay, and then comes the another table that we can design if we want to consider the doctor, like who is the doctor who is going to treat that patient. That information we need to store, right? And who is going to take care of which appointment and all. So for that sake, we are maintaining one more table called doctor table, and we'll hold all this information about what is the ID of the doctor, unique ID, and what is the specialization of the doctor, and all those things. Okay, and one more thing is a billing management module. So billing management module is nothing but this module is responsible for generating the bills and invoices and insurance and all those things. Okay, so for that we can come up with a table which will be linked to the patient. Like so that's why again here a patient ID is being managed as a foreign key here. So every patient gets a bill generated based on the treatment that he has gone through, and each bill will have a unique ID, and it will have amount, like when the billing date was done, what is the payment status. Okay, so that's how typically we can come up with these set of tables and manage them for based upon the different modules. Okay, so these are the some of the typical terminologies that you see or you hear, each of them will have their own things. Like EHR is nothing but a employee health records or electronic health records, we can consider them. Um, these are like electronic medical assistant, like automated assistants that will give us all the prescriptions and everything. PHI is the one more word that you hear often, which is nothing but protected health information. Like everything that you see, like every patient information that needs to be protected, that should not be given or shared without the consent of the patient. So that is come or termed as a protected health information. And PII. So this is a general terminology that you hear in banking domain or anywhere or healthcare domain, personally identifiable information. So this is like private information that will help in getting the details about a particular entity, or who it could be a patient or it could be a provider or some like that. With this, using this information, we can understand what that patient is like. It could include our bank account number, it could include our Aadhaar number, social security numbers, like that. Okay. And EMS means emergency medical services. And yeah, CC means chief complaint review of ROS review of systems. That means it will go through the whole review of what our vital signs and everything. And HPI means history of present illness, like what is the history when you are getting this headache, from how many times you are getting headache, all that history, it will be maintained here. Okay. That is a term, that's abbreviation is history. And fire is the another term that you often hear, which is like it's a standard, or it is a format that every EHR system will follow, or rules that every EHR system follows, which is called as fast healthcare interoperability resources. So the only reason this if an EHR system follows this fire standards, then what benefit that we'll get is interoperability will be easy. Like one EHR system can talk to another EHR system easily using this fire. And then CCDA is one more term that you often hear, which is nothing but a continuity of the care document. That means whatever the documentation that we go through in the mm, mm, in the when we are getting the treatment, right? Every patient getting the treatment, that is termed as CCDA. And CDA, clinical document architecture. So these are very typical terminologies or abbreviations that you need to one needs to know in the healthcare industries. And there are more, but these are some general high level things that we will be hearing about. Okay, those are the things that I try to cover here. Uh, yeah, so this is how generally we'll till this point in time I tried to cover all the general healthcare domain terminologies, and what are the different modules, what are the different roles and responsibilities that you will be hearing in an EHR based systems. Okay, if not, I'll move away. I'll move forward. Like the next step is to see how we can come up or design how we can take Azure data engineering, like Microsoft Azure architecture. How we can take the advantages of that and come up and build the this EHR systems, or where we can use it. So one such a typical example that we can look into is like, let's say um, there is a COVID-19 scenario. Okay, one more example that we'll take is uh, see, for interoperability, for one EHR system to talk to another EHR system, even though typically two hospitals will be operating the same software, but every hospital will try to customize the software application based upon their needs and based upon their standards. So even though the same vendor is going to sell the same software application to the hospital, but no two hospitals will have the same application. They will not be using it in the same way that we have given. And they'll be asking the vendors to customize the format of the data according to their norms and policies and according to their standards. Okay, that's a that's a typical workflow that we see. Now what happens if the same vendor selling same software to two different hospitals, but still those two softwares cannot talk to each other, because there will be so much of specializations or customizations that each hospital will ask us to make, the vendors. So that will make the EHR systems uh, difficulty in interoperating between each other, like whenever okay, whatever the discussions that we have gone through, like for transmitting the patient records, and for talking to another lab, so like that, for getting the results and all. So for that sake, what happened is there are some standards that have been provided, or a data formats that healthcare industry has asked each of the EHR system to follow certain standards, certain data formats, certain codes that each EHR system needs to follow, so that the interoperability between both the systems can be done. So you follow whatever you want, but if you want to talk to each other, talk in this common language, talk in this common standard, so that it won't impact. So that common standards and common language are called as HL7 standard. So HL7 means nothing but the abbreviation of the HL7 is like it's like health level 7. It's a standard organization which will provide a framework which helps in exchanging the electronic health information, EH, EHI, electronic health information, or electronic health record about the patients. So that standard is called as HL7, and one more standard is FHIR, like fast healthcare interoperability resources. So that these are two different standards that either of the uh, electron EHR system can follow for interchanging the information between one to another. Okay, so and whatever you are seeing here are like some of the events that each of them, like whenever a patient is admitted to a hospital, they consider it as a admit, and then once he discharge transfer. So this is one type of a functionality according to these standards. So we need to follow, like whenever a patient has been admitted, we can say ADT, new patient, like that, some terminologies that they have come up or they have followed. So okay, so one more standard that is available in the healthcare industry is redox. Redox is a one more standard which will help in which will help in the electronic EHR integrations between two EHRs. If we follow redox standard, we can talk to each other common. Okay, that means these are some of the EHR integrations, right? That means whenever a patient has been joined, okay, so we need to put this information into that centralized repository, which is a EHR based the integration repository. Integration system is the middleman or a middle standard database. So that's a centralized database which will be holding all the information, from where like a library. It's like a library from where one EHR can get the information and the other EHR can feed the information, so that the communication can be possible. So like if you want to transfer a patient from one hospital to another hospital, this hospital will maintain its own database structure, the other hospital will maintain its own database structure and information, but how the patient can be transferred easily. So for that, the middleman, the standard like HL7 standard database, or a redox database or FHIR database, that centralized database will be available. Okay, so there it will store that information and you can fetch and feed both. So that means here we have to talk to that centralized repository. That centralized repository, we need to communicate frequently, and whenever a record has been generated in our EHR system, then the same information needs to be fed into that centralized repository. Okay, so that means integration between both the systems. So this example we can automate using our general Azure data engineering pipelines. So if we take an Azure data engineering pipeline, so here you can see a typical opportunity for automating this whole system. Like whenever a patient has been started adding into your record, into your database, so you can send that you need to send that information to the centralized repository. That means you can automate this whole process with our whatever the architectures that you must be going through in your Azure data engineering courses, like uh, three medallion architecture, like bronze, silver, and gold. Uh, so those things you can come up with a pipeline, an Azure pipeline. Like, so if you want to integrate these systems easily, automatically, you can come up or design a pipeline where as soon as a record has been put into our database, EHR database, so we can create a pipeline, Azure pipeline, which will try to mm, listen to this SQL database or whatever database it is, and it will read that information, and it will ingest that information into some common storage layer, like uh, Azure Data Lake storage or anything like that. Okay, and then once that ingestion is done, data ingestion is done, so we can typically we may need to transform the information. So what is the transformation involved here? So our data is in one certain format, and the centralized repository will accept the data in certain format, like it will accept certain properties, it will accept certain values in certain format. So that transformation, we can use the Azure Data Factory pipeline, and we can ingest the data, transform the data, and using the Azure Data Bricks, we can modify the data as per our standards, and feed the data into uh, into a centralized repository by calling their APIs or whatever it has been provided. Okay, so this is one typical example where we can use our Azure pipelines to automate this end-to-end thing, instead of doing it manually, or writing our own software. So we can use the or we can take the opportunity of the Azure pipelines, automated pipelines. Okay, that is one typical example that we can look into. And one more example that we can consider is like COVID-19 data analysis. Like, for instance, if you are having a if you are asked to provide like how much some reports or some graphical reports to analyze the COVID-19 data, and present the information. So in such scenarios, what we can do, we can use the or we can come up and build the Azure pipelines. So this is a typical thing you can easily understand. Like, we need to feed that information or get the information, fetch the information from a third party APIs, which are going to provide us these details. Like, okay, like there are several government websites which will provide all the information about the COVID-19, like how many patients have been affected, how many patients have taken vaccinations, how many are like took all the phase 2, phase 1. Like, if you want to provide a report out of it, then there will be a government website which will provide it, and then we can use the Azure Data Factory to ingest this data into our pipeline. And once the data has been ingested, so we can transform the data as per our standards, as like remove all the unwanted information, and take the information that we are interested in, uh, run this through three pipelines or three layer architecture: gold, uh, bronze, silver, and gold. And then we can store that information into Azure Synapse Analytics, into a separate database, and we can provide that information by doing the data analysis, by writing queries, and prepare those information and feed it to some reportings, like Power BI or all. So these are like some of the examples that you can take up from this using the Azure data engineering pipelines. Uh, the other things that I wanted to talk to about is like some common data types or common terminologies that one needs to know. Okay, I think I have covered that, uh, like demographics and all, uh, family history, allergies, immunizations, medications. Yeah, those things I have covered. Yeah, I think this is pretty much like this is how we can use the Azure, like some use cases that I've provided, like automating the integrations between one EHR system to another EHR system using our Azure pipelines. Because It involves ingesting the data, storing the data, and even transforming as per the standards that we need. So yeah, these are the some of the things that we can typically look into when it comes to the healthcare domain.